Well, good afternoon and welcome to AI and Safety, Streamlining Your Responsibilities Effortlessly. So as you and I, if we were having that conversation, probably what we would say is, how is it that I can use AI to start working a little bit smarter, not harder, and that you can keep up with that task load that continues to increase and it feels really difficult at times. So if that is something that you're struggling with today, and you're looking for ideas, you're looking for different solutions, you definitely came to the right place, and we are so glad that you're here. My name is Holly Foxworth. I'm a registered nurse, and I am the Director of Marketing Communications here at Axiom Medical, and I'm going to be your host today. And for those of you who may be new to Axiom Medical, what we do is we provide occupational health services to organizations across the United States. We cover Canada, we cover Mexico, but we cover work-related injuries and illnesses along with behavioral health and then also employee absence management. So we like to keep the majority of those cases, those injuries in-house, so that we can make sure that we can save you time, money, lost productivity, but most importantly, we can make you look like the heroes that you are within your organization. You show those great little charts that show where your safety trends have improved there. So anyways, we appreciate you joining. We do have a fantastic panel that is here today. We have two new faces that you've never met before. Then you're going to meet them shortly, but we have Dr. Scott Cherry. He's our Chief Medical Officer here at Axiom. We have Dara Wheeler, which is our Chief Marketing Officer and EVP of Product and Innovation. We also have Calvin Titus from Flex System. He's going to talk to us a little bit about how AI can empower some of your frontline workers and improve some of the communication, training, things like that. And then we also have, and I've been practicing his name. I'll tell you guys, I've been practicing his name. And it's Byro Kaiser, Dr. Byro Kaiser, and he is joining us all the way from Germany, all of you guys. So, and it is 8 o'clock his time. So we definitely appreciate him joining us for that. He is the founder of Wear Health. And so he's going to share how AI-powered wearables are really kind of reducing some of the ergonomic injuries that we see, a lot of those sprains and strains, along with improving your workforce health. So before we do so, let me kind of get you acquainted with what you're looking at here on your panel, on your monitor here. So the first place that I want you to look is that right-hand corner. You should see a yellow looking box, and that is the next webinar that we're going to be having for November. And that one is Safety Culture Shift from Must-Do to Mission-Driven. It's going to be on November the 6th, and that will be at 1 o'clock p.m. Central. That is going to be one of the best. I'm really looking forward to that one because we have a gentleman from Champion X that has a fantastic story, and he's going to bring on his Axiom account manager that he has, and they're going to really talk about how it is that they've been able to shift the culture and make some huge changes within their organization. I think that you guys will get a whole lot out of that. So definitely make sure that you don't miss it. All you need to do to get registered for that is just press that RSVP button, and then that will get you automatically registered. It'll send you a calendar invite. There's nothing else you have to fill in, anything like that. There are several ways of communicating with us. We have two different ways here, as you may have seen. We have an attendee chat that's there, and so you guys are welcome to utilize that, talk amongst yourselves, whatever you want to share. And last time was the first time that we utilized that, and we had some great engagement that was there. Everybody was sharing tips, tricks, and their ideas, their stories, and things that are happening to them. I was even thinking about today that, especially when we're talking about AI things, that if you're using AI in a way that you think that would help other people, drop that in the chat so that we can all learn from each other, whether even if it's just using ChatGPT to kind of compare your policies and your procedures, but put those there in the chat and so that you can help other people as well. Below at the bottom of your screen, that's where you'll find all of the resources that are there. So you'll see not only the slide deck from today that you're welcome to download, but you'll also see resources from both of the organizations that are here today so that you can reach out to them, ask any questions. I know that they would be more than happy to answer those for you and help you in any way that you possibly can. We will be recording this, obviously, and we'll send it out. Usually it comes out within about 24 hours after the live event, but definitely we're thrilled you're here. And I will give you just a little hint that I love to give out gifts after these events for everybody that's engaged. So if you like to receive gifts, I ask questions, stay engaged, and participate in that attendee chat. Keep the conversation moving, and definitely I'll be in touch with you. I picked several after these and send them some thank you gifts. So make for sure that you're active, and if there's anything that you want to share, that's the place to do it. For those of you who may be traveling, we do have one more live event that's coming up in November. We're going to be going to the National Comp Show. That's going to be in Nashville, Tennessee. I think that's November the 11th. So if any of you guys are going to be there, please make for sure that you stop by the booth. We'd love to see you and take pictures, give you some great swag and things of that sort. I think that about covers it. So at this point, let's go ahead and meet our panelists. Dr. Cherry, we'll start with you, followed by Dara, and then we'll move on to Dr. Esteban, and then we'll finish with Calvin. So Dr. Cherry.
Thank you, Holly, and good afternoon, everyone, and thanks for tuning in. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer, and my professional background is I'm a board-certified physician in preventive medicine, public health, and occupational environmental medicine, and I've been supporting the military, government, and industrial operations for the past 20 years, and it's a pleasure to be with you today.
Fantastic. We always love having you here. All right, and how about you, Miss Dara Wheeler?
Hi, everybody. My name's Dara Wheeler. I'm Axiom's Chief Marketing Officer, and this is my, I think, 18th or 19th year with Axiom. It's all just been a wonderful almost 2 decades of work with our clients and helping deliver care to their employees. So I'm really excited about this topic. It's one that Holly and I have been talking a lot about internally, and we're happy to bring a great panel today.
Absolutely. All right, you're up next, Dr. Byro Kaiser. Oh, I think you may be on mute.
Thanks, Holly.
There you go.
Hi, everybody. It's a pleasure to be here. Thanks a lot, Axiom Medical, for inviting me. Holly, thanks a lot for practicing the pronunciation of our name. That's flawless. So my name is Esteban. I'm the CEO at Ware Health. My professional background is I have an engineering background. I did a PhD in artificial intelligence at the Institute for Artificial Intelligence in Bremen, Germany, where we kind of built the base technology for Ware Health, and we started afterwards Ware Health. And today we're active in Europe, South and North America, helping different types of industrial companies to reduce injuries and keep the workforce healthy and productive. So looking forward to a great webinar.
I love it. Well, thank you so much for joining us. All right, Calvin, you're up.
Yeah, thank you, Holly. I'm happy to be here, so appreciate the invite here. Happy to see everybody. My name is Calvin Titus. I work with a company called FLX, and we make frontline technology for people. So my background is primarily in software, and so I work really closely with organizations that are getting really strategic about how they're engaging and interacting with their frontline workers. So think about people, on the floor, in the field. And then I also work really closely with our product team, who is developing a lot of the technologies, especially AI related for today. So anyway, happy to be here and happy to take part.
Fantastic. Calvin was just telling me, I'd met Calvin at one of the trade shows this last year, and he was telling us that he had utilized one of the hot and cold packs. So we might include that in some of the gifts that we send out after these events. So if you're interested in those, make sure that you put in your questions there and sharing. So, but in terms of kind of what we're going to go through today, what we really want to do is talk about how it is that you can simplify some of your routine tasks, some of those admin tasks. So, whether it's anything from policies and procedures, whether it's updating, whether it's schedules, whatever it may be, that you have that's on your plate that you want to get rid of. That's what we want to talk about, how that you can do that. We're going to go through some real world examples that show you how the progress that they've made in compliance and reporting. And then also we're going to talk about where AI really adds value, but then where you also really need to make for sure that you have human in the loop there, that the human judgment remains essential there. So we're excited about what we're going to discuss today. But before we jump into that, I will start with a poll and just ask all of you guys, and you're welcome to put it there in the attendee chat, but tell us, where does your workload pile up most? Where does your workload pile up most? Would you say that that would be in reporting and documentation? Would you say that that would be in compliance tracking? Maybe ergonomics? I'm sure ergonomics a lot for some of you. I've heard a lot of that in injury prevention, training and communication. Let us know what it is that you seem to be struggling the most. Dara, what do you anticipate that the top one is going to be?
I don't know. Reporting, probably.
It does. It looks like there's a lot of, we've got them coming in the box, the attendee box, and the question. All right. Some say all of the above. Well, you're in the right spot then, definitely. Fantastic. Well, we appreciate you sharing that with us. There's no wrong answer there. We just want to get a feel for what it is that you're struggling with the most, because that helps us to be able to deliver the right kind of thought leadership and material that you need to be able to improve your organization. So first off, let's move on to Dr. Sherry. And actually, I have asked Dr. Sherry if he would talk to us kind of about the administrative burdens that are impacting some of these nations, some of the organizations, and then what kind of that big picture of AI looks like, especially from safety, and where that shift in balance seems to occur.
Yeah, Holly, so let's maybe start with the big picture. And I was just thinking about it today. OSHA turns, I guess, 55-year-old this year. So OSHA was started in 1970 as a federal agency. And so there has been dramatic process over the decades in safety and health for employees. But if we actually look at the current data, there is kind of a sobering story where workplace injuries and illnesses are still a major national challenge. So I think there was low-hanging fruit at different times over the history of workplace health. But, now as new technology comes, I think there's an opportunity to look for new technologies and policies that address that. So the most recent Bureau of Labor and Statistics report shows over 2.6 million workplace injuries and illness every year. And so, there's still many injuries out there that shows us this is a signal of continued large-scale scope and scale, that there's a lot of safety challenges out there that organizations face. And then, there's a new reporting rule electronically where right now, I think this past year, there's over 370,000 submissions through the federal injury tracking application. And so there's more and more visibility in real time through this electronic reporting. And so there's just this large visibility into employers' safety performance, which really can impact the morale, but also the reputation of companies. Wow. So in addition to these incidents, the level of reporting, scrutiny, and accountability is rising too. A lot of safety executives, at least 3/4 of safety executives polled, say the compliance is already is affecting their operations, and over 85% feel that the complexity of reporting and compliance has increased in the past 3 years. So, obviously in the States here, we have federal and state regulations and jurisdictions to be focused on, and there are potentially different interpretations across the overlapping state and federal requirements. So what that means to safety and health teams is they're spending more time chasing paperwork than actually preventing the injury. And so I think there's, every organization is in a different state of maturity with regard to this, but still a lot of injuries and safety programs are reactive. And so as technology evolves, it really will help us be more proactive in, pattern recognition, predictive analytics, and even documentation. So, this poll is very interesting because, Holly, if you had asked me which one of the four was going to be the biggest drag, I really couldn't differentiate. So that just shows that it's really a multifaceted problem that can be burdensome across all aspects of the safety program.
Absolutely. Absolutely. Do you feel like that AI then is going to be able to help transition us then from that reactive approach to then that proactive that we're really looking for, and that would have an impact?
Certainly. And, we're hearing more and more of AI across everything in our world. And we really personally, I want to integrate it as much as I can to make me a better person and a better professional. And I think this is a great opportunity where these large language models and then new technologies that are specifically focused on safety can start being integrated into a safety program and making the human aspect, each of us as human workers can focus on the most value generating aspect of it. So having intelligence, predictive analytics, and then the compliance side is maybe even more important. I hate to say that, than the actual preventive. You have to document the compliance component as well. So I think AI can really be a force multiplier across all aspects of this.
I agree completely. Whenever we talk about technology, Dr. Byro Kaiser, you're the one that's really kind of on the front row here, looking at it from it sounds like that you've started from the very beginning and you've built it all the way through. So talk to us about what that looks like and the impact that's really kind of having, what that's doing for ergonomics, how wearables are impacting the safety culture, et cetera.
So I think a lot of interesting keywords and important keywords have been mentioned. So for example, what is the impact of AI? How can we shift from a reactive approach to a proactive approach? And I think this is where AI can help a lot. So, or also you mentioned is trying to put kind of the human as the final decision, but there's a lot of tasks which if we do it manually, it takes a lot of time. It's inefficient. So AI can help us to really make our lives easier in a sense of automating a lot of processes where we don't need to be there on a daily basis, but we can take the key decisions. So, and basically what AI is doing, it's analyzing vast amount of data, detecting patterns, and providing us for the decision making. In the case of ergonomics, so for example, today ergonomics is one of the, or if not the number one cause of lost time work days. So it's a very significant problem to solve, and obviously you have also the poll has a lot of questions. So for example, one of the questions was ergonomics, but it affects everything, right? It affects compliance, it affects documentation, it affects productivity. So there's a lot of issues there to detecting risk and prevention. There's really no one way to solve everything. The most efficient way of preventing ergonomic risks or reducing ergonomic risks is fully automation. So that's the most safest way for the workers. But obviously, that's not always feasible or possible. So then companies can optimize the process, can optimize the workstations, can train workers to move safer. And this is kind of where AI and wearables play an important role, because they can provide data, or they can provide, first of all, key insights on where to optimize the process, or on on where do you have the most risks. On one side, from the data for example, for the management, right? So you have data of insights in terms of the risks, so that you can be proactive based on those insights. But also, you can include the worker. So putting the worker kind of in the middle and using these wearable technologies to train the workers. So, for example, with what we're doing at WearHealth, our solution is basically a wearable that workers wear. They clip it on their clothing, and this wearable detects unsafe movements in real time and notifies workers of those unsafe movements. So thus workers step by step can learn what are the unsafe movements that they need to avoid and learn how to execute them better. So this helps kind of both sides. So workers start learning, and within weeks they already start reducing their risks. So and that's kind of the key role of AI. So in an ideal case, you want the on-site health and safety manager looking all the time how everybody's performing the task and giving them feedback. Hey, look, this is not the way how to bend, or this is not the way how to pick up this box, or this is not your posture is not proper, it's not safe. So that would be in an ideal world. But obviously, there's only a couple of safety managers. They're busy filling out documents, compliance, so they don't have the time to do that proactive approach. But this is where AI comes in place, where that proactiveness can be done, automate that, do it very effectively and very easy for both the workers and the management.
Yeah, definitely. It seems like that we hear more and more. When we meet safeties, it feels like that. I'll ask them, kind of what their territory is or what division do you work with, and sometimes my jaw drops when I hear the amount of people that they are expected to cover from an HSC perspective. So it seems like that this definitely makes sense. That this would definitely give you an appearance, or you'd be able to tell what's really happening on the floor without having to be there. I saw that there was a question that had came up, and they were just asking about, does it record all events? So can talk us through what it does record and what that would look like.
Yeah, definitely. So it's also important when it comes to wearables, it's also important to mention what it doesn't record, right? So for example, workers, there's no audio recording, so workers can still talk bad about the boss. That's not a problem. That's a very important requirement. But what it does record is basically movements, right? So the ergonomic movements. So there's several ergonomic risks. For example, lifting with the back, right? Or twisting, tilting, static postures. So that's focus on the back, but also you can wear the wearable on the arm. So you have the way how you're pushing something or pulling something. If you're with the arm at certain angles. So those are kind of risky postures, and it counts them. It counts them at what time, where did they happen, so that afterwards you kind of have a very rich overview of the risks, of the evolution of risks throughout the day, but also where they're happening and how often they're happening.
So I would assume then that would be decreasing the number of injuries that you guys are seeing then with that.
Yes, definitely. So first of all, we see that workers, for example, in logistics or in manufacturing, they already, after using the wearables just a couple of weeks, they already start performing their tasks safer. So that's where, for example, you can see a reduction in risk, and that translates immediately in less pain after a couple of months and less injuries.
Wow. That's amazing. What have you guys seen? Have you had any case studies, or have you had any stats that you've been able to pull that really talks about, that's really shown you kind of the impact that this has had on organizations that have implemented this?
Yes. So with our solution, this is kind of an average, but it obviously depends on the work process and the company, but we can reduce up to 78% of the ergonomic risks.
Wow.
And that leads up to a return on investment of 230%.
That's wild. That's wild. We've had some additional questions that came in. One was from Michelle and was asking who it is that's monitoring all these events. That's such a great question. Where does all this go? How does that get from the employee, what's happening with the employee, to the safety manager or to the operations staff that are overseeing some of these things?
Yeah, so at the in first, and this is where the worker is kind of at the center. These events are to notify him, right? Because every time, because the sensor vibrates and gives a sound, a peeping sound, and thus the workers, okay, now I moved something wrong, so he can immediately do corrections. So he can change his behavior. So if he has lifted something with his back, right? The sensor vibrates, and that's kind of a small reminder, hey, that movement wasn't safe. Do it differently, do it better, do it safer. It's kind of a gentle tap on the back, right? It's having your ergonomist on the back, basically. Yeah. Training you along the way, coaching you along the way. So those events in real time are important for the worker. Then at the end, all of that data is aggregated into an online dashboard where management or a health and safety manager can access and see key insights such as trends, or also see how the risks are reducing over time.
Wow. We had another great question. These are good. You guys are asking great questions. I'm excited to hear
amazing.
utilizing AI in your workplaces now. But the question was, so would this notice a change throughout the day, like good form in the morning, but as the day goes on and the workers get tired, then maybe their posture changes or they're doing things differently? So that's a great question. It makes a whole lot of sense that you definitely have a lot more energy during the day, the morning times, than you would towards the end of your shift.
Yes, definitely. So it's also time pressure has an impact on, like if you're working fast, you need to finish the task list, and you say, okay, forget it. I'll just go through it. So that's the mindset. But the goal is kind of to do this behavior change step by step, so it's not a training program of a couple of days and that's it, because then maybe you did your best to perform and then you fall back to older habits. So that's not the goal. So for example, we recommend to train people with the sensor 2-3 months, and then it starts to turning into a solid habit that you can afterwards start working without the wearable, because you got used to the new posture. It's kind of a second nature to you. So it can happen, obviously, at the end of the day, you start forgetting or just maybe ignoring the sensor. But if you use it for a couple of days, couple of weeks, then it starts to be very, very effective, as it starts to be something, your new behavior.
I would think from the aggregated data information, I would think that would really be helpful for the safeties as you're looking at, how they're performing in the mornings. Maybe you need to change what time that they're taking their breaks, or maybe you need to look at different shifts, things like that. There were other questions about would this strictly prevent back injuries, or does that cover shoulders as well?
It covers both. So back and shoulder. So you can wear the sensor on the back, or you can wear the sensor on the shoulder, and it helps in both cases. What you're mentioning, I think it's very important. The data gives you, in terms of, for example, in terms of compliance, it gives you actionable information now, right? It gives you an overview of how are my risks today, right? So you have already a result of your preventive actions that you're doing, because risks are reducing. And it also, so at the beginning I mentioned, in terms of prevention, there's a lot of things that you can do. And one essential part is changing behaviors of people. But there's going to be situations and for certain processes where that's not the case, right? And you will see that in the data. You will see that, hey, here or at this time, or in this particular process, it's not changing. It's changing somewhere else, but here it's not changing. What's happening? So then based on the data, you can take next steps. You can look a little bit deeper and maybe already take decisions on how to optimize that process or that workstation.
Mm-hmm. There was another question about, do you have to program the types of movements specific to the industry? That's a great question too. I wouldn't.
Yeah, I think everybody's paying attention, so the questions are great.
Mm-hmm.
That's a good thing. So the way that this sensor works is a worker would use the sensor for 2 weeks, and the sensor doesn't give feedback, so it doesn't vibrate. It only collects data. So thus kind of building a baseline of what is the current process and what are the current risks. And after that, it decides automatically on the most significant or the most repeated risk. So for example, if a worker has, let's say, 35 unsafe bending per hour, then it will start there until it improves, and then it moves to the next risk. And the next risk could be, for example, twisting. Then it starts providing training for twisting. So step by step reducing the risk. And that's done at an individual level. So it could be that 2 workers, or let's say a team of 10 workers, go out and every worker has its individual training.
Wow.
And that's done by the AI.
Done by the AI. So it would be industry agnostic then. So, I mean, it wouldn't matter what industry you're in. It's going to be tracking what movements you specifically are making within your role. Exactly. Wow, that is fantastic.
Holly, could I ask something really quickly? Because, you know, I think even myself, we were thinking, or I was thinking personally, like, this is great for the individual and probably the population with regard to injury prevention, but we've also been focusing on fatigue management, and it almost feels like, based on one of the audience's question, like obviously as someone fatigues, their form may decrease, and so this is probably a great tool for like fatigue risk management at the individual and population level, and it also can give management, like if everyone in this a certain work group is actually starting out with good posture, but then ending with, if they're starting out with good posture, but ending with bad posture, that could actually be a sign of too much demand for the workforce. And so I'm just brainstorming, this could be used in many different ways. Have you thought about it as like a fatigue risk management program as well?
Yeah, that's a very good point. So, and this is, whenever you see a graph of risk throughout the day, you want to see graphs that go up and down.
Okay.
Up and down. Why? Because when it goes down, it gives the person a period of rest, right? I'm resting. But for example, we also have seen in several processes, and it starts compounding. So at the end of the shift, it goes up, and you see less those spikes going down, and kind of a recommendation there is figuring out of implementing breaks, strategic breaks at those critical times so that they can rest. Because while doing that, you're resting and you're already reducing the risks, right? So giving them 15 minutes of rest already reduces the risk, and then it doesn't increase as before. So that's where the data is very useful to implement such strategies.
Interesting.
Yeah, great. Dr. Cherry, I was going to also ask, so I think the way you described it, it informs the individual, and so over time their behavior changes. Does it also inform then the safety team on, have you seen it paired with other prevention measures in terms of making sure to, like, if everybody's having a breakdown in shoulder mechanics, are we using that data to now potentially in the future improve shoulder mechanics or different? Is it kind of becoming this virtuous cycle of informing then better processes, better, I think you said this, but also, like, I know a lot of our clients use stretch and flex programs and different things. Is it informing some of those programs as well?
Yeah, so I think, for example, the stretching and flexing is important. So that's something, kind of a fundamental thing that should be done. And if you have data, you're making informed decisions, and most of the time you don't, not always you have the budget or the time to do everything, right? So, but you need to target kind of where do I have the biggest pain point, and that decision, that's where data comes in and helps you. You know, like if you have a specific process where things are not changing and the data is showing that, that's where you can invest, where you can focus investment of time and resources to solve. And it can be solutions such as modifying the height of the workplace so that people don't need to reach or bend low. It can be, we have seen customers that, for example, in the logistics sector, when boxes need to be filled, they change the size of boxes so that workers don't need to grab so deep into the box. So there's a lot of things that can be done in the environment itself. But if you're just doing those things based on manual or just visual inspections or subjective feedback, that's not enough on having kind of a strong decision. But if you have the data, then you can also, that's also a very powerful information, not just to convince yourself or to understand what to do, but you can convince your team and upper management to do to implement the right strategy.
Yeah, we'll take one more question, then we'll talk to Calvin. But the additional one was, how does it know the difference between the different body dynamics, short, tall, in shape, not in shape? How would it make the determination between those?
Yeah, great question. So when it comes to ergonomics, there are specific international standards and guidelines on what is defined as what is an unergonomic movement, or what is an unergonomic posture. So we use those guidelines. That's the way that we design the algorithms. But there's different types of postures of people, right? So the way that they stand. And that's where the algorithm also adapts itself to the natural posture of the person. So for example, you wear it just for a couple of minutes, let's say over 10 minutes, then it starts understanding, okay, this is a natural movement when he's not working, right? And thus detecting the unsafe movement with a higher accuracy because it's adapting to the movement and the body posture of the person, of the individual.
Wow. Such a game changer. It just seems like that this is such a new time in safety that's so exciting. I nerd out about it. I'm sure that some of you do too. I know at least Dara does, but we've talked about everything from wearables like this to hydration monitoring, and it's an exciting time for people that are working, that you may not have as many injuries and illnesses as what you previously had. But Calvin, will come to you, and we talked a lot about how it is that you would get information to the front line, and then how you're kind of working with your frontline staff. So talk to us about the FLX system and kind of what some of those common challenges are, what that can do in terms of improving communication between your team.
Yeah, absolutely. So I think there's a couple of things. One, I guess to lay the groundwork as far as what we do, we really we provide technology to those people that helps get information to them in the field and then also capture information from them. So a lot of that is related to safety and compliance, forms that they're filling out, checklists, audits, things like that. And something that we've been very careful of from the beginning, as kind of the AI revolution has kicked off, is being really careful about trying to support the frontline worker and not trying to replace their brains and their processes. And I think there's been a lot of people that have jumped really quickly to, and we talk to people at events and stuff all the time where they'll go, hey, we want something that we just walk around with our device and then it finds all of the safety and compliance issues in the area and then it documents them and the person doesn't have to do anything. And I kind of I would push back a little and say that that's not what you want. There's a reason that people are certified on these processes and these procedures, and I don't think AI is something that we need to replace the thought process of somebody. But we've kind of taken a pragmatic approach to go. Let's let the people work the way that they know how to. Let's let them use their insights and their experience, but let's just help them do it more effectively. How can we get information to them easier? How can we give them another level of accountability maybe? things like that. So I think that's kind of the approach that we've taken, rather than trying to say, hey, let's, throw AI is the silver bullet. Let's just throw it at everything and it'll, good will come from it. So we tried to avoid that.
So would that include everything from like education modules, or like, I don't know, there's so many things that go through my mind when I think about so many opportunities. It makes me think about like toolbox talks, that you could record those and put those on there, to send out to your team if you could make it to all those different locations. Do you see it used in some of those different ways?
Yeah, I'll take you through the 3 ways that we've mainly used it today. So the first one, which we've been using a little longer, is first of all just an AI-assisted search to help people find information. So think about being on the floor in the field. I need access to a procedure. I need access to product information, anything like that. We've used an AI-assisted search functionality for a while, where people, voice to text. I'm looking at this part. I'm looking for this procedure. I'm typing it in, to be able to serve people quick content in the flow of work. So when they need it, rather than having to go ask a superior or something like that. So I think that's the simplest and longest we've been working with AI. The second way, which is a little more complex, is how we're using AI as it relates to inspections and audits. So as a little background, we've got a patented piece of inspection technology that we call visual proof. And before the advent of AI, we had it even then, where we're essentially, rather than doing like a digital checklist or something like that, we're using a video-based inspection that uses overlays to walk somebody through a process. So imagine maybe I'm doing a truck on an inspection on a truck, a pre-trip. I might walk up to the truck, and rather than do my digital checklist where I can kind of maybe pencil whip real fast and go, yep, all good. We scan into it and say, hey, I'm working on this truck, and it's going to walk me through a series of overlays while it's capturing everything I'm doing on audio and video that says, hey, check the tires here. Are we going to pass or fail that step? Hey, check the headlights. Are we going to pass or fail? And then at the end of that, we have an entire video. We've got reporting off of that. We can manage workflows, all of those things. So anyway, that's what we had done previous to AI. And what we've done to enhance it with AI is to kind of go even further with the level of accountability, is to use AI to recognize and validate objects. So for example, if the step says, hey, go and check and make sure that the forklifts the fire extinguishers are in the right place, it's going to validate that I'm looking at a fire extinguisher, that I'm not looking at, the ground or something like that, that I'm actually capturing what I'm doing. So there's a level of accountability and kind of helping the person through the process as it relates to completing audits and inspections. So that's kind of the second way that we've used it. And then finally, the third way is where you were going, Holly, I think, which is kind of producing content and helping people from that perspective. Because what we've seen a lot of is we're in this kind of interesting time with, as it relates to content, where there's a lot of companies that are going, the generic content doesn't cut it for us, because sure, there might be, healthcare content that trains on this particular safety topic, but, maybe our nurses we do at-home practice, something like that. So they're not actually relevant. The stuff that I'm training on, I've got this generic content that I bought from a content provider that doesn't relate to my people. But at the same time, your subject matter experts maybe don't have time or the technical skills to be producing a lot of content themselves. And so what we've done is integrated that into the learning management portion of our platform to help people make really quick content that's actually based off of their internal documents. So think, hey, I need to make a quick training on how to do XYZ process with a patient. I can actually select within my system, hey, use these 3 SOPs and build me a training course on this. And it will use my internal documents to actually not only build out the questions and stuff, but it'll actually create the training in the system. So it'll build out the questions, it'll build out all of that. And then I have the ability to kind of edit it and spice it up. So rather than think about it, a ChatGPT or a Gemini, where you kind of have to go all or nothing, like, hey, do this. And then it produces you something, and then you pause and go, well, that's not really what I mean. I wanted to make this little change. So rather than having to do that, we can kind of do larger prompts that use our internal documents or policies that produce training content that I can go in and edit later on. So those are kind of the three main pillars that where we're using AI. I think probably the most differentiated one is with the video-based inspection. That's something that's really unique that I haven't seen a lot of. But again, we're being really careful about not wanting to replace the user. We don't want to make the user take a back seat. We want the user to be actively following through in the process, and where we can help them, we think that's a win. So
absolutely. You know, the other thing, and Derek, you may remember this from one of the lunch and learns that we did last year, but one of the problems that was identified by many of our clients was that their workforce is getting older. And so you have these subject matter experts that have been with the company for years and years and years, and they have so much knowledge, but their bodies, you know, it's not at that point where it still can perform at the same level that maybe it once did. And so you have new hires that are coming in. So it would be interesting to be able to take some of the knowledge that they have, that they've used for years and years, and be able to translate that to share with the younger workers. Have you ever seen it used like that?
Yeah, it's funny you bring that up. That's actually another way that we've used that technology. So the same one that we use for kind of inspections and audits, we use it for something that we call peer-to-peer learning in exactly that way. And so the way that it works is somebody can come into the system and say, hey, I'm recording myself doing an SOP or whatever it is. Let's say they found a new way to do a process. They can actually record themselves doing it. And then once it's completed, we send it up to kind of the leadership to approve it or deny it. So you might see a process where you go, whoa, we don't want anybody doing that. That's a bad idea. Hey, Holly, don't ever do that again. You know, there's things like that. And then there's maybe things where you go, hey, you know what? That is a great way to do that. And so if I approve it, then I can push it out as an SOP. So the next time that you're in the field going to look for something, and you do kind of, one of those AI assisted searches, that's maybe what you're going to get is a video of Holly doing a process that we thought was really, a fantastic idea. So it is. And you brought up a really fantastic point with that sort of tribal knowledge sort of transitioning out of the workforce. And I think a lot, especially the frontline companies or industries that we work in, where there's lots of, trade heavy and things like that, that's where they're really, really struggling with, a lot of the knowledge is retiring out of the workforce, and how do we capture it in a way that we can pass on to the next folks. So that's a fantastic point.
Next generation. Absolutely.
Yeah, we're seeing it, I think, Holly, on both sides. And I think this actually gets to Dr. Esteban's product too. It's the knowledge base of the older generation needing to be passed on, the physical challenges, but also that the younger generation entering the workforce is less physically capable as well in terms of being able to perform safely. So there's just kind of these multi-layers to mechanics breaking down. We had a former company that we worked a lot with that did physical testing for pre-hire, and they continue to publish a lot of papers on degradation and muscle strength, especially at the shoulder joint. And so it sounds like, all of these components kind of leading to changes in workforce dynamics will mean that this data becomes even more important as we try to maintain better safety programs.
Mm-hmm. There was a great comment that I love that Paul put in here. He was talking about the not replacing the relationships that you have there, but also he was talking about how AI would allow safety pros to focus more time and energy on some of the projects and the mental health, the wellness, things like that, which are such an epidemic within. He had said the construction industry, but we're seeing it in all industries, and it just seems like this would be a total game changer. Calvin, what are you seeing? Like, what have you had any feedback in terms of, what kind of time that this is saving HSE managers or anything along those lines?
Yeah, 100%. So I think as far as a time and an energy save is related to what we can get our eyes on. So as it relates to doing inspections and audits and being able to go through and in a very efficient manner comb through maybe troublesome areas. So for example, I might not need to go look and watch every video of every pre-trip that's been done. That might, that's a huge time suck to try and go and look at all of those. But what might be helpful is, hey, maybe I pull a report on the pre-trips where some of the steps weren't validated. And so I can go see, hey, I've got these 4 pre-trips that popped up today that the steps weren't validated. The person was not looking at what they should have been looking at. So we've got a problem. We either have a training problem that we need to show people, what they need to be focusing on, things like that, or somebody's maybe, skipping through a process, something of that nature. So that's been a huge time save, just from not having to go through every little file, but being able to, spend your time much more, kind of dialed in on troublesome areas. So
Absolutely.
Yeah, so if I can add on top of that, and also considering the final 2 comments, I think definitely AI is not there to kind of replace, but make, for example, the safety manager more impactful. So whatever he can do it better, faster, and smarter, and kind of a bigger reach, so that his skills, his strategies, turn into better results. And that's I think kind of the role of AI. So not making the safety manager irrelevant, but making him more powerful and effective.
That's fantastic. I love it. Well, one of the other questions that comes up anytime we speak AI or we speak new technology, the first question that usually comes up with people is, kind of what is the cost, or, how do I get my admin to buy into this? So Dara, I'll come to you for this one. What are your thoughts in terms of how you would, look at an AI solution if you were wanting to implement something like that in your organization?
Yeah, I think the biggest thing to think about in considering any solution is it's essentially the same type of business case you build for any type of business case. And so I think we're all really excited about the new capabilities and where we can go with technology. But at an executive level, when our CEO is evaluating it, he's evaluating it in a similar way that he would any other business case. So it's either going to improve revenue, it's going to reduce costs or improve efficiencies. There has to be the same kind of consideration in a solution that you would have for any business solution. So I think that sometimes companies are looking for the next thing, and then they jump in without really kind of building out the business case. And so these are some examples that Holly's put together. But I think when you consider the business case, you're looking at, especially within this AI and safety realm, you're looking at connecting the dots between AI, safety, ROI, what's that return on investment, just like any business case, and does it fit in with the culture? So to the audience's point, humans still are here for a reason. There's still a lot of reasons that human in the loop, AI and technology relationships exist. And so it has to continue to drive the culture and fit in with the culture of the organization. So when you think about the case studies here, Holly's got a couple of examples. There was an example of a semiconductor manufacturing, their platform, their Observe platform cut alarm handling by 90% and achieved about a 200% ROI. And then this HICO benchmark looked at 1,400 records, flagged 823 high-risk precursors. So these are data-driven ROI decisions that when we think about when to implement, how to implement, and this time horizon is really critical. So when we're looking at evaluating it, we're looking at the cost of the technology, the improvements, and the time horizon in which to get those improvements. And just like anything, executives want measurable outcomes. They want to look at time saved, risk, and compliance, and whether these different technology improvements will improve those different components. Otherwise, the decision might not be to implement the technology if it's not going to improve in a specific time frame those key areas. And so that's the way I think of it. I'm sure the rest of the panel has opinions on that. I'll pause.
Yeah, I'd love to jump in there. It's interesting. I like the way you're talking, being strategic, the way that you're going about some of these projects. There was a study that came out, I'm sure a lot of you have seen, that MIT put out, I think it was in August, that said 95% of AI projects were failures. in the sense that they didn't make any measurable impact on the P&L. And so I think one thing that I've seen is companies that are just they see AI as kind of the silver bullet, but they're not necessarily trying to solve their specific problems with it. They're not being really strategic about what they're trying to do with it, and what those problems are that they're solving for. They're kind of coming at it backwards, going, hey, we just want AI. We don't care what it is. We want AI. And I think that's a dangerous way to look at it. For example, we've got companies that'll come to us that are looking for safety management systems, LMSs, and they'll say, all right, so on our list of, we've got needs and wants. We've got 3 core needs, and then these are our nice to haves. And the 3 core needs will be like, we want to be able to sign out to custom groups. We need really robust reporting and AI. And you go, okay, what do you want to do with AI? And they go, well, we're not sure, but we've got to have AI in it. And I think that's it's not a strategic way to look at it. You're going, okay, well, that's fine. And I think AI is a really powerful tool, but you got to have an idea of what you're trying to accomplish with it. So I think I really like this approach.
Totally agree. I totally agree. And it's, I also lead our product organization, and a lot of the conversations have been similar in that it's like, people come to me with the tool and they're saying, here's all the tools we want to use. I'm like, no. What's the process? What's the business challenge? What's the problem? What are we trying to solve? It's still the same discipline that we've had from the beginning, and process and making sure that we understand the business challenge. The tools are ways to improve the process, but we still need to fundamentally follow that. And I think it's exciting. Everybody's really, I mean, it's really, it's generating all this excitement, but it is still a cost, and there needs to be consideration around what is the best solution. And it might be no solution. It might be a lot of things that are, it's this, and MIT does a really great job with generative AI equations and really kind of driving that push through traditional business case practices, because otherwise it is the bright shiny object that people are jumping to. Sorry, Dr. Eswat, I think you were jumping into.
Yeah, so I think, I mean, AI is a powerful technology. There's a lot of use cases that it can address. There's a lot of use cases that it can't. So I think it should be seen as a new technology, but what is more importantly, what is it capable of doing, and assessing that first, assessing the problems that a company has, then understanding how AI has been implemented to solve the particular problem. Because AI by itself, it's not going to solve every problem. So the AI is not the solution, it's how the AI has been implemented and how it has been trained, what is kind of what it has been trained to do is the most important thing to know.
Yeah, agree. Well, I'm going to ask all of you kind of rapid fire questions here then. So what would each of you say in terms of one key lesson learned, or something that you would advise, or best practice whenever getting started with AI? So I'll start with you, Dr. Cherry. What's your thoughts? What's your best advice here?
I think, AI is an amazing tool, but we still want to have humans kind of overseeing the decisions or the recommendations that AI makes. So having, the experts still in charge of final decisions and just validating those decisions. Yeah.
Dr. Barbara Kaiser, how about you?
I think it's prioritizing what decisions you can do and what you can kind of automate or offload, or what activities you're fine of offloading and which are the activities that you're not fine offloading. I mean, taking that decision is important, and then certain tasks, but the AI reports to you and you take the final decision. That's very important.
Calvin, how about you?
Yeah, I would say one thing to really consider is the security of your data and what you're doing with it. A lot of times this frontline safety and compliance folks, the operations folks, maybe lose that's not the top of mind, and then they're making a really big headache for some of the IT, cybersecurity folks that are going, whose models are we training with our data? Where is it going? Are we just dumping this into Gemini? Are we dumping, what LLM are we using? Are we plugging in using our own? I think that's a really important kind of frame of mind or a reference to keep in mind is what are we doing with our data? I think that's something that people oftentimes overlook, and they're just dumping stuff in chat, GPT and stuff, sensitive company information. So absolutely.
Dara, wrap us up here.
Governance is everything. It's still back to really good business practices. The new technology is amazing, but having really good business practices and solid governance is everything, because then you can really decide for you as a business where humans interact with the technology, and all of that becomes, and I think the term governance sounds so cringy, but it's so important when we're driving with, like you said, the data and the technology, and making sure we know exactly what we're doing with it. So a great conversation. I really appreciate everybody staying with us and asking great questions. And I know Holly's going to keep bringing this topic to the forefront because it's a good one.
Absolutely. Yeah, we're at time, so we'll wrap up. But if you guys haven't already, make for sure that you click that RSVP button. We definitely want to see you this next month, and we thank you for joining us. Stay safe.